Okay, let's unpack this. Today we're diving deep into a topic often unspoken, really, in demanding professions: moral distress. Imagine facing this profound internal conflict between what you believe is the right care for someone and then what institutional constraints or just the realities of the situation actually allow you to do. That internal struggle. It has a name, a powerful one, and it affects those we rely on most.
Yeah, and what's fascinating here is that moral distress isn't just some abstract idea. It's a very real uh, emotional, cognitive, even physical reaction people have. Now, while it can definitely lead to burnout, interestingly, it can sometimes serve as a catalyst for growth, maybe even moral maturation. This deep dive is actually based on a unique mixed methods study. It looked at Israeli physiotherapists, trying to really understand, what causes this distress and, importantly, how they cope.
Right. So the study started with a survey, over 400 physiotherapists. What did those initial quantitative findings show about, well, how common this is? Were there any maybe surprising patterns or groups that stood out?
Well, they found a moderately high average level of moral distress right across the board. But what's more, it was significantly higher among women and also among those working with children. And here's something really curious, a paradox almost. As a physiotherapist's moral sensitivity increases their awareness of ethical issues, so does their distress.
That is a fascinating paradox. It almost
Yeah.
seems counterintuitive. You'd think caring more, being more sensitive, might lead to better outcomes, not necessarily more distress. Did the study get into why that might be the case?
Well, this is where the qualitative interviews really bring the numbers to life. They talked to 21 therapists. And connecting this to the bigger picture, these interviews revealed some intense emotions, deep inner conflicts. For instance, many therapists shared powerful experiences linked to a sense of futility.
Futility.
Yeah, that internal conflict of providing care when they feel deep down their work might be pointless. Because patients are suffering greatly or are dying. One therapist grappling with this just asked point blank, why bother?
Wow. That's incredibly tough. It's like being asked to bake a cake with half the ingredients missing, but still expecting a masterpiece. The frustration must be immense.
It really is. And another striking theme was truth-telling. Therapists talk about this moral tightrope, managing expectations for patients and caregivers, sometimes feeling they had to sort of avoid the truth, particularly about prognosis.
Hmm.
And then there were the constant pressures of organizational constraints, things like limited time, not enough manpower, leading to what one therapist quite tearfully admitted was superficial care.
Superficial care. Yeah.
Yeah, she described it as a terrible conflict,
Yeah.
saying you end your day feeling you did your very best, but it still wasn't beneficial. Just heartbreaking.
It gets even more compelling, doesn't it? They mentioned the solitude of these struggles. One therapist said, sometimes you are morally distressed just from feeling that this is happening only to you.
Mm.
That isolation.
Exactly. And remember those treating children. They reported persistent, high levels of distress, and it didn't matter how experienced they were. They basically said you just can't get used to it. It's a burden that apparently never truly lightens.
Which naturally raises a really important question. How do these dedicated professionals actually cope? How do they manage these profound challenges day after day?
Well, they did mention some coping strategies, things like reflective practice, seeking professional support. That came up. But there was an unexpected finding, too. Most therapists were surprisingly unfamiliar with their own profession's code of ethics, or even their ethics committee, if one existed.
Really, that suggests a significant gap then in formal ethical knowledge or support structures.
It seems so. And despite this, senior therapists, highly competent, highly morally sensitive people, still felt burdened by the distress and also by a perceived lack of professional autonomy.
So maybe the most profound insight here is that moral distress isn't just some negative thing to be stamped out. It might actually be an intrinsic marker of humane care, linked to compassion. Like that therapist who said, if I had less distress, I wouldn't be a good therapist.
Exactly. It suggests the goal isn't necessarily to eliminate it entirely, that might even be counterproductive, but rather to empower professionals with effective ways to cope with it, to manage it.
So when you boil it all down, what's the ultimate takeaway for you from all this?
Look, moral distress is clearly complex. It's deeply intertwined with personal factors, professional ones, and crucially, organizational factors. So effective coping has to address all three. You can't just focus on the individual.
Given these deep systemic issues, what practical solutions did the study actually propose? How can we help?
Well, the study points towards things like training ethical counselors within healthcare settings, people on the ground. These counselors could offer guidance, help facilitate moral deliberation, make sure professionals don't feel like they're facing these dilemmas completely alone.
Right, breaking that solitude.
Precisely. And ultimately, healthcare organizations themselves need to foster environments where professionals feel empowered to act as moral agents, to use their competence, rather than feeling they have to repress these vital, albeit difficult, experiences.
As we wrap up this deep dive, it really leaves us with a broader question, doesn't it, for all of us?
Yeah.
How do we as a society truly support those who dedicate their lives to care? How do we ensure they have not just the skills, but the tools and the environment they need to navigate these incredibly profound ethical challenges? Makes you think.